Imagine getting treated for a fungal infection that just refuses to go away. While you think you're doing everything right, the doctors recommend further screening, and it turns out to be skin cancer. This is what nightmares are made of. This was the reality for a 29-year-old woman whose skin cancer got misdiagnosed as a fungal infection. What followed was an uphill battle. In today's video, we'll be telling the story of a Welsh woman who received a shocking diagnosis after noticing a pea-sized mole on her scalp. Why should you need to take skin cancer seriously? What are its symptoms? We'll be discussing all of these and more. Firstly, what is skin cancer? Skin cancer is more common than you think. It occurs when there's an abnormal growth of skin cells. One of the main reasons for skin cancer is too much exposure to ultraviolet light. If you're out in the sun for long periods without sunscreen, your risk of skin cancer increases. Your best bet against skin cancer is early diagnosis, and for that, you need to be aware of its early signs and symptoms. Never ignore weird changes in your skin. BBC journalist Sarah Lee's diagnosis is a warning for each and every one of us who ignore unusual changes in the skin. What she assumed to be a fungal infection was actually melanoma. Sarah first noticed a mole on her scalp back in July 2021. Her family doctor immediately referred her to a dermatologist who initially told her that the mole was very unlikely to be malignant. However, in the next few months, the mole had grown and multiplied. Sarah sent pictures of it to another doctor who told her it was a fungal infection and would go away without the need for treatment. Thankfully for Sarah, she was not convinced. She sent the pictures to yet another doctor who referred her to another dermatologist. This dermatologist got the moles surgically removed and sent them in for a biopsy. What the biopsy showed was shocking. Sarah had stage 3 malignant nodular melanoma. This meant that the cancer had spread to her lymph nodes as well. To get rid of cancer in the lymph nodes, Sarah had to undergo surgery. The surgery took 8 hours with 24 lymph nodes being removed from her body, including the neck. As of right now, Sarah isn't showing any signs of cancer. However, she still takes medicines to help block the cancer if it were to come back. One of the side effects of these drugs is vomiting. Imagine what would have happened had she not taken the mole seriously. Here are some other skin cancer symptoms. Not all skin cancers have the same symptoms. In some cases, you may not even show any initial symptoms, but you should always pay attention to changes in your skin as it can help diagnose the condition a lot quicker and make it easier to treat. If you see an unusual mole or bump, or even a dark spot, it could be a sign of skin cancer. This is especially true when these unusual skin lesions don't disappear after a few days. The same is the case when the two halves of a mole don't appear to be symmetrical. If the lesions come with ragged edges or are uneven, it could be a sign of skin cancer. The size can also be an indication. Most times, it would be more than 1/4 of an inch, essentially the size of a standard eraser. If a particular spot on your skin has an unusual color, such as blue, pink, or red, it could be a sign. The lesion may also have more than one color. Sometimes you'll see that the mole on your skin is changing and evolving. It could be a change in size, shape, or color. It may also be itching or bleeding. Now let's talk about the types of skin cancer. Basal cell carcinoma is a type of cancer where the basal cells are affected. Basal cells are the ones responsible for clearing out the old cells and replacing them in the lower level of the epidermis. This type of cancer is usually seen on the surface of your skin. Normally, basal cell carcinoma does not spread to other parts of the body. When it does spread, it can turn out to be life-threatening. Experts suggest that around 80% of skin cancers in the world are basal cell cancers. Squamous cell cancer is another common type you need to watch for. While basal cell cancer affects the lower level of the epidermis, squamous cell cancer affects the outermost part. You'll find squamous cells in areas such as the lungs and mucous membranes. Squamous cell cancer is also caused by repeated exposure to sunlight. The good news about squamous cell cancer is that it can be treated, but if you leave it without getting treatment, it can be life-threatening. Experts suggest that squamous cell cancer is the second most common type of cancer. Over 5 million people are diagnosed with either basal or squamous cell cancers every year. Melanoma accounts for 1% of all types of skin cancer. It develops from the abnormal growth of cells that give the skin its color. These cells are called melanocytes. Typically, melanocytes form non-cancerous moles, but they can turn cancerous too. Melanoma can occur anywhere in your body. For men, it's commonly seen as the chest or back. For women, it usually occurs on the legs. In most cases, melanomas are treatable, as long as they're caught early. If they're not treated, they can spread to other parts of your body. It's more likely to spread than basal and squamous. So what are all the causes? Like we said earlier, skin cancer can often happen from exposure to ultraviolet light from the sun. It can also be because of exposure to sunbeds, which people use to try and tan. Experts suggest exposure to these sources of UV light significantly increases the risk of skin cancer. If you have pale skin that burns easily, you're very likely to get melanoma. If you have blonde or red hair, your risk of getting melanoma increases. People who have family members with melanoma also have a higher risk of getting this type of skin cancer. You need to take a lot of precautions if you're going to be exposed to UV rays for a long period. Sarah Lee always used SPF 30 sun creams. She also grew up in a region where the sun rarely comes out. She was still diagnosed with skin cancer even though it took 6 months and multiple consultations. In one study, it was seen that you had a higher risk of melanoma if a family member was already diagnosed with it. This could be from any number of reasons, including genetics, a shared lifestyle, or even the same skin tone. People with a family history of cancer should get themselves checked regularly and avoid the use of tanning beds or sun lamps. Another reason to be aware of skin cancer signs is if you already had a history of being diagnosed with it. In one study of nearly 1,000 participants, it was seen that 17% of the people experienced recurring cancer, especially as they got older. This drives home the importance of getting regular follow-up checkups. If your immune system has been weakened from other medical conditions or treatments you're undergoing, you would be at a higher risk of skin cancer. Certain medications can weaken your immune system. You may also have an autoimmune disease. If you're already undergoing chemotherapy for another type of cancer, your immune system will already be weakened. From here, your risk of skin cancer increases. Just as Sarah Lee found out, anyone can end up with skin cancer. Many are under the impression that you can simply remove the mole and get rid of it. That's certainly not the case. You need to get regular checkups done and always wear sunscreen and hats. Skin cancer can be terrifying. Interested in knowing more about similar health challenges? Let's keep the conversation going with a couple more videos, shall we? Watch 6 early signs of mouth cancer you should not ignore. You should also learn about a new blood test that can predict a heart attack years in advance. Go ahead, click one, or better yet, watch both and learn more about your health. Did you know about skin cancer in detail before watching this video? Let us know in the comments below.